What's going on, everyone? Welcome back to my channel. In today's video, we're going to look at 4 exercises for heel or calcaneal spurs. These are little areas of bony growth on the heel bone that typically cause pain on the sole of the foot, almost like a plantar fasciitis. So if you look at my foot, what usually happens is that if you have an x-ray, you'll see a bit of bone growth on the front of the heel. So usually it'll hurt people kind of in this region at the front of the heel. The interesting thing about these bone spurs is that they do occur in asymptomatic people. So it's not a guarantee that if you have one, it's the cause for your symptoms. Luckily, the exercises that I'm going to show today will help with pain on the sole of the foot, whether or not it's coming from a bone spur or not. So if you've got pain there, stay tuned for today's exercises. Before I jump into today's video, I just want to mention that my new book is available on Amazon and Barnes & Noble. It has rehab programs with pictures of me doing the exercises for the 50 most common conditions. And in the ankle and foot chapter, there is a plantar fasciitis program that can help with heel spurs. The program will walk you through 3 phases of rehab, and again, is more comprehensive than my YouTube videos. So if you're looking for a resource for the whole body, I'll put the links down in the description. For our first exercise, we are going to perform a soft tissue mobilization or self-massage of the calf muscle. So you're going to take a foam roller and basically just kind of work your way through your calf muscle using your arms to kind of lift your butt up and massaging the area. You can start like this, where just one leg is kind of stacked, and you'll work all the way through those 2 calf muscles. We're working on these because our calf muscles run down and of course attach to the Achilles tendon, and then there's fascia that wraps around the heel onto the plantar fascia. So if we can loosen up the calf muscles, a lot of times it can help with heel pain. So I'd start here like this. If this gets to be too easy, you can take your other leg and stack it and then kind of roll like that, and that definitely makes it more intense. And you're just kind of rolling through there and trying to loosen up those calf muscles. Sometimes if you find a tender spot, you can pause and then take the other leg off and kind of move your ankle through plantar flexion and dorsiflexion to mobilize those muscles with an additional movement. So for this one, just work through the area for approximately 1 to 2 minutes, and this is something you can do every day, even several times a day, to help reduce tightness in the calf muscles. For the second exercise, we're going to take a massage ball. You could use a tennis ball or a lacrosse ball. This is called a pinky ball. You can order online. It works great for this, but we're going to mobilize the plantar fascia and the muscles underneath it. So you're going to set that ball on the ground and basically work from the front of the heel. Just be careful not to push too hard on your painful spot. But you're going to roll through the arch of your foot all the way up to the base, the balls of your toes, and then back across. So you're working, again, the plantar fascia. And then underneath the plantar fascia are a bunch of layers of muscles. A lot of people don't realize how many muscles are in the sole of our foot. But just like massaging other muscles, that's basically you're working here. You're working those deep arch muscles, which again can help take tension out of the area and reduce pain associated with a bone spur. So again, like the last one, work through here for 1 to 2 minutes. You can do it every day. You can do it several times a day, as much as it kind of helps reduce symptoms. Our next 2 exercises are going to be stretches, where we're going to stretch the calf and the plantar fascia. I'm going to use a tool here called the fasciitis fighter that works really well for targeting the plantar fascia. You can find these on Amazon as well. So it's just got a little hump here that our big toe is going to go on. And basically in the research, what we've seen is that if you put your big toe up, it helps to target the plantar fascia. So I'm going to do 2 calf stretches. The first one here is going to be the typical knee straight variation. So I'm going to step forward with the other leg, keep the knee straight, and then stretch. And again, I'll probably feel this in my calf, but I may also feel it on the bottom of my foot. Having that big toe up in dorsiflexion helps to stretch the plantar fascia and some of those deep intrinsic muscles in the sole of the foot. So for both these stretches, we're going to do 2 to 4 reps and hold for 15 to 30 seconds. You can hold longer too, it varies person to person, so just find the length of time that's best for you. So this is the knee straight variation. Then I might take a break from that. And then the knee bent variation is the other calf stretch. So again, I'm going to stretch forward, but this time I'm going to bend my knee. And this stretch is usually a little bit lower down towards the Achilles tendon, more in the soleus muscle, which is the deeper calf muscle. So again, look for 2 to 4 reps, 15 to 30 seconds. You could space these throughout the day and just again kind of go back and forth between the knee straight variation and a knee bent variation. Okay, so those are our 4 exercises for a heel spur for reducing pain. Also, you might want to, with these, just consider trying an orthotic temporarily, trying different types of shoes, maybe adding a little cushioning to the shoe to take some pressure off of that heel spur. So if you have any questions, please put them in the comment section and I'll try to get back to you. All right, you guys, see you next time. Bye.